Hello, and my name is Melanie Manigault, and I will be giving a presentation on fibromyalgia. Very hard to pronounce. But basically, this is an illness that does not have a cure. However, there are certain treatments, and then this is just a presentation on how it affects exercise and how one is affected. So, what is this condition and how is it diagnosed? So, FM, it is a disorder caused by musculoskeletal pain accompanied by fatigue, memory loss, sleep apnea, and even certain mood issues. Even though it has similar symptoms to arthritis, it is not in the family nor considered a form of arthritis. Certain symptoms include headaches, migraines, very severe head pains, irritable bowel syndrome, which bowel syndrome is affected. It affects the large intestine. It can cause diarrhea, gas, any type of abdominal pain. And then also pain below the waist, losing focus, short attention span, again, back to memory loss. And then it can also lead to very severe cases of depression. Like I said before, it cannot be cured by any means, but there are certain measures that one can go to for treatment. So medications, these medications will ultimately cure just muscle pain, help someone who has FM sleep better at night, since sleep apnea is one of the symptoms. Um, Educational courses is another form of treatment, basically educating someone on how this illness affects their body, why they may have gotten it, genetics, hereditary causes, and then also exercise, which I will talk about how exercise is considered a form of treatment. Cognitive behavioral theory and physical therapy, which basically is self-management skills, as pictured, dry needling, which is similar to acupuncture but not as similar. Dry needling basically finds a muscle that one of the muscles that is typically giving the problems, or where someone is experiencing pain, and then it finds it and excuse me, finds a trigger point for that muscle. So that's another form of treatment. These these treatments typically help someone, but like I said before, it doesn't make the illness go away. It just helps them prepare for when pain is getting worse, when they're experiencing more fatigue. Exercise testing. So, verbal and written testing or training for those who suffer from cognitive dysfunction. Ensure that the client has had the proper amount of rest the night before their testing, even though having trouble sleeping is one of the symptoms. Just ensure to them, try to go to sleep at a decent hour so that the next day you aren't as tired during your testing. Monitor pain and fatigue during the duration of testing. As always, if someone is experiencing dizziness or lightheadedness, automatically stop the test. Constantly ask about pain during testing. Um, Constantly checking their RPE, on a scale of 0 to 10. How are you feeling? Anything over 5, please monitor closely, of course. Adjust their seating as needed. Take away weights. Decrease the reps. Anything to make them feel comfortable until they can progress up to where you want them to be. Exercise training. Educate the client on how they should feel after the test, but also educate them on how they should not feel. Oftentimes people will say, no pain, no gain, but that's not always a good thing. After maybe a week, if the client is still feeling how they felt by the first 2 days, then their symptoms probably have already gotten worse, which means additional treatment or additional training will be needed for them to overcome their situations. Make use of the FIQ, which is the Fibromyalgia Impact Questionnaire. This helps determine how severe one's symptoms are prior to training. This also helps the trainer get an idea of how pain levels are before the client will do something such as walking, sitting for long periods of time, shopping, exercising, and things of that nature. So now, fit recommendations. I have broken them down into aerobic training, resistance training, and also flexibility training. So with fibromyalgia, someone should not automatically jump into trying to do 3 to 5 days a week of training, of hardcore training. They should start at about 2 to 3 days a week and then eventually progress to 3 to 4 days a week, just as just to see like where their symptoms are, how they even do with training, with certain trainings. Intensity should be less than 30% or their heart rate reserve, and then move up to about 60%. Again, not trying to, make them run for about 15 consecutive minutes. Just have them do maybe 5 minutes of running, 2 minutes of walking, and things of that nature until they can move up to the time that we need, which is 10-minute sets for 30 minutes a day. Even though the standard recommended time for young adults, youth, or even just older adults, anyone in general, is 60 minutes a day. People with FM typically have to definitely start out at a lower time until they can progress and exercise for long periods of time, being that their muscles aren't cooperating or just any of the other symptoms. Types of aerobic activities: walking, jogging, cycling. Like I said before, someone should do about 5 to 7 minutes of walking, see how they feel, and then eventually progress to that 10 minutes of steady walking, and then take breaks and then do that for 30 minutes. Or you can even switch it up, have them cycle, see how long they can do before they experience any type of fatigue, and then go from there. Try to have a goal outside of that. Resistance training, again, frequency 2 to 3 days a week. Definitely stick to about the two days a week, just because resistance training will typically involve weights, which some people with FM may not be able to lift the proper weights. And then intensity should be from about 50% to 80%. Again, just keep it at a minimum, especially with resistance training. And then if they are not experiencing any pain, you can go to that 60% to 80%. The time, 3 to 5 reps per muscle group, increase to 2 to 3 sets. So with the 3 to 5 reps, just keep it at about 1 set, see how they're feeling. If they want to progress, again, constantly ask, how are you feeling? Are you experiencing any fatigue? Are these weights too heavy? And then eventually progress to 10 to 20 reps per muscle group with 2 to 3 sets. And then the types of exercises, weight training, elastic bands with different resistances. Start out with maybe a lighter resistance and progress your way up to a heavier resistance. Ankle weights, start out at about 1 pound of ankle weights, and then eventually go up to 2, 3, and so on. Flexibility. This can actually be pretty beneficial for people with FM. I'll start with types. Anything with like elastic bands, yoga. Again, yoga can help relax the body, relax the mind, especially with someone who is experiencing depression. Just keep them at ease. Frequency, about 1 to 2 days a week, of course, and then eventually moving up to 3 times a week. I would say stick to about two times a week, even though it's 1 to 2, just because again, this type of activity can be beneficial for someone. Intensity, keeping the exercises, at a minimum, trying to actually hold stretches for about 15 to 30 seconds versus like 10 seconds, even though when clients with FM start off, they would probably be able to hold the muscle that's giving them pain for about 10 seconds. Just try to progress up to about 15, 30 seconds, even a minute. And then again, hold the stretch for about 10 to 30 seconds, progress holding for up to 60 seconds. And then I just listed the types, elastic bands, yoga, and then any kind of stretching in general to help them with their activities, with their muscle groups. So, as always, there are some special considerations to take in when dealing with someone who is experiencing fibromyalgia. Teach clients the proper way to handle equipment and perform exercises to reduce injury rates. This is just because if they want to eventually move off and branch off and work on their own at their own personal gym or homes, they'll know how to properly handle equipment so that their pain, it won't get worse, and then they can always, stay ahead, go off, branch off from the 2 to 3 days a week and actually move up. Enlighten clients on why it's important not to work beyond levels of fatigue. As I said before, it wouldn't be beneficial to keep working until you feel you're experiencing too much pain, being that it'll just set you back and you'll be back at square one. Patients with FM should exercise in a temperature and humidity controlled room to keep symptoms at a controlled level. This is because if someone is exercising in a room that's too hot, this will increase their levels of fatigueness, dizziness. But also, if they're exercising in a room that's too cold, they won't proper functioning. They won't, sorry, function properly. And then yoga and other therapies can help to reduce the risks and symptoms of FM. As I said before, depression, it can help, keep that person at a calm level. And then also yoga can help stretch out muscles that are too tight. And then that is my presentation on fibromyalgia. Thank you.